This training program will instruct employees regarding the structure of the back, common back problems, proper lifting techniques, posture, and maintaining a healthy back. The back is made up of many components. These consist of the spine, spinal cord, and muscles. The spine is the part of the back that supports the trunk and head. It protects the spinal cord as well as giving flexibility to the body. Vertebrae are small bones that form the spine. They are connected together by discs which act like shock absorbers. With the brain, the spinal cord makes up the central nervous system. There are approximately 400 muscles that help stabilize the spine and help with the proper posture. There are several injuries that can occur to the back. Injuries are often the result of years of neglect, causing the back to become weak. Any sudden movement or improper lifting technique can cause injury. Some forms of back injuries include strains, overflexion, sprains, overextension, ruptured disc, pinched nerve, and muscle spasms. Strains are caused by overstretching, bending and lifting incorrectly, slouching, and carrying extra body weight. Strains occur when muscles in the back are overused or overstretched. A herniated or slipped disc results from repeated strains or overstraining and are usually very painful and cause lost time at work. This is when the jelly-like fluid in the disc leaks and puts pressure on the surrounding nerves of the spinal cord. The loss of fluid in the disc also allows the vertebrae to rub against each other. Overflexion is another type of back problem workers face. This is caused when you bend over too far, causing pressure on the discs in your spine. Another form of back injury is sprains. Sprains are caused by sudden movements or twisting of the body. Sprains are usually ligament injuries because the muscles don't have time to react. Overextension of the back is caused by arching backward too far and putting all of the weight of the load on the facets between the vertebrae. A ruptured disc is the tearing of the disc, releasing the jelly-like substance. Although injury to the outer covering of a disc can cause pain, often a ruptured disc by itself does not cause any discomfort. Pain occurs when pressure from the ruptured disc is put on the nerve roots or spinal cord. Another common form of back problem is the pinched nerve. A pinched nerve occurs when too much pressure is applied to a nerve by surrounding tissues. This pressure disrupts the nerve's function, causing pain, tingling, numbness, or weakness in the affected area. And finally, muscle spasms are another form of back problems faced by workers. Muscle spasms are involuntary contractions of a muscle, often caused by receiving too many impulses from the nerves, causing it to contract beyond capacity. To minimize the possibility of a back injury, employees need to practice safe and correct lifting techniques. Plan ahead. Before lifting an object, know where it will be placed. Be sure the path you take is clear of any obstacles. This will help prevent any awkward movements while carrying the load. If lifting with another person, agree on the plan beforehand. When ready to pick up the item, make sure to bend at the knees and keep your back straight. Focus on keeping the spine straight to shift most of the weight off the back and onto the legs. Keep your eyes up and look straight ahead. This will help you keep your back straight. Your feet need to be kept at a shoulder's width apart. This gives you a more solid base to help provide more support. If your feet are too close together, good balance will be too difficult to achieve. If your feet are too far apart, your movement will be greatly reduced. When making a turn, move your feet into the direction you wish to move. Never twist your back. You should tighten your abdominal muscles when lifting an object. Keeping your abdomen tight will help your back stay in a good lifting position and help you keep from straining your back. Be sure when lifting an object that you keep it close to your body. This helps keep the body stabilized while lifting. When the object is too far from your back, additional stress is placed on your back. Get a firm grip on the object to help you keep it balanced. When lifting any object, be sure to do so with your legs. Your legs are stronger than your back. Use the strong leg muscles in your favor. When lowering an object, bend your knees and keep your back straight. In some instances, it is a good idea to use equipment made for such tasks, rather than attempting to lift an object on your own. Carts, dollies, forklifts, hand trucks, wheelbarrows, hoist, chains, and ropes are some items which can make lifting and moving items easier. Good posture is important for a healthy back. If your job requires you to do much standing, make sure not to slouch with your back bent. Keep your back straight, shifting weight from one leg to the other every few seconds. Hold your shoulders slightly back and keep your chin, abdomen, and buttocks tucked in. Shift your position frequently. Raise one foot on a stool or step when standing stationary for long periods of time. Preventing back injuries requires proper lifting, good posture, exercise, and having a proper diet. Maintaining a proper weight reduces stress placed on your back. When lifting, you should always remember to plan ahead, bend at the knees when lifting or setting an object down, keep your feet shoulder width apart, lift the object close to your body, tighten your abdominal muscles, and to always lift with your legs. Remember to maintain good back posture, whether lifting, sitting, or standing. And it's always a good idea to stretch or exercise before work to reduce strain on your back. Only you can prevent the most common causes of backaches. The result is freedom from back pain and a stronger, healthier back.